reported first case of COVID-19, which has now got everybody in a frenzy in the country, from buying masks, hand sanitizers and hand wash. It's all flying off the shelves of stores. But are we protecting ourselves correctly? Are we doing the right things? Joining us now in the studio is Discovery Health's Dr. Noluthando Nematswerani. Doctor, good morning. Thank you very much for coming in.
Good morning.
Yeah, basically, it's a case maybe of prevention than cure, and there are things you can do as a person currently to ensure that you don't get infected by this virus. Am I correct?
You are very correct, and I think these are measures that we have always been recommending, even during the influenza season, because these are basic hygiene practices where we're saying people must wash their hands thoroughly with soap and water, running water, and make sure that you do not touch your face frequently. And also, I think the most important thing is that we encourage people who are sick to stay away and not spread, these infections. And if you do, if you are coughing or sneezing, exercise cough etiquette, which we talk about covering your mouth with a tissue or using your elbow to actually cough and not spread droplets that could infect other people. So I think it is really just re-emphasizing the importance of good hygiene.
Yeah, we have a graphic there from the World Health Organization. They've been spreading that message across the world to people to say, these are the basics, wash your hands often, and there's a way that you should be washing them. You've said you must use soap and just practice.
And running water.
And running water.
Yes.
The water must be running.
So that, you really make sure that your hands are clean.
Yes. If you don't have soap, is it a train smash?
So, if you can get access to hand sanitizers, alcohol-based hand sanitizer, it's still okay, because there are instances where you may not, be close to a place where you can wash your hands. But there are other means and ways of trying to minimize the germs.
Yeah, one of the colleagues of the production team here, Tabo, was saying, but then there's a way that you wash your hands. Ask the doctor, is it just you just quickly wash, or you have to wash the back and the front, between the fingers? How do you do it properly?
That's why we talk about thorough washing, where you wash in between and make sure that you wash the whole hand and make sure that it's not 2 seconds, it's about 20 seconds of really properly washing. So I think for us, we really encourage that. And I think regular hand washing is also important, because you may have washed, but then you go to the toilet, you touch certain surfaces that might be contaminated. And also, if you're sick, you may touch yourself. And if you don't go and wash, you then can expose other people.
How about spitting?
Spitting is really wrong. It's really an unacceptable health, it's a health hazard, because those droplets, if you are spitting and there are people in close proximity, they could actually, be at risk of contracting any diseases that you might be having.
Okay, now, how do I know I've got COVID-19? How do I know I've got COVID?
Okay. So coronavirus is one of the respiratory viruses, which is viruses that cause respiratory symptoms.
It exists in the world generally.
So no, but this particular one is a new strain. There are other ones that cause common cold. There are some that have caused severe disease before, like the SARS in 2003, and the MERS, which is the Middle East respiratory syndrome.
COVID-19 is a different animal altogether.
So COVID-19 is a new strain, which is why we are a bit anxious about it, because we don't know much about it. So as we learn more about it, we will then, have better information.
Okay, so what are the symptoms I should look out for?
So the reason why I started with that introduction, it is really to explain that it is behaving like other respiratory viruses that cause, cough, shortness of breath, and for some patients they might have running nose.
Sore throats?
Sore throat, you may have a sore throat. So I think the most important thing is that you may not necessarily, you may have the symptoms. These symptoms could overlap with other, conditions such as influenza, especially now that we're going into the flu season. You can have those overlapping symptoms. The only way to confirm whether you have it or not would be obviously if the test is done and it is positive.
Yeah.
But I think for us, which is why there is what we are referring to as case definition. At this early stage, we know that if people have been in an environment that that has got local transmission of this virus, which obviously, if you look at our first confirmed case, they were in Italy, where there is real, spread of the coronavirus. That becomes a high-risk person because of the exposure in that environment. But if you are in South Africa today and you've not traveled anywhere, you've not been exposed to anyone with a confirmed coronavirus, and you experience symptoms that we've just mentioned, it's unlikely that it could be coronavirus.
I think that's a very important message. I hope my producer Bhavna was listening there, because we're debating this. How do you know going into the flu season that is flu? But the message is, if you haven't been, unlike our compatriot in KwaZulu-Natal today, not been exposed where it is active like in Italy, and you suddenly get a flu here locally, you are unlikely to be having COVID-19.
Yeah. It's very important, and I think at this point, because we have not had, we refer to it local transmission, and eventually when it is widespread in our communities, then it becomes something different. But if we were to get to a position where now it's all over, then people could still, have coronavirus. But at this particular point, really, if you are experiencing those symptoms, it could be other respiratory viruses that are currently circulating in our environment.
And you can go and get checked. I mean, I had a sore throat and I was sneezing at the end of January, and I phoned my doctor, and they did a swab, and I was surprised when I got my results back that the lab had tested for 2 strains of coronavirus already at the end of January. I didn't ask for it. I had something respiratory wrong with me, and I was pleased to note that. Thank you very much, Dr. Noluthando Nematswerani from Discovery Health.